Alright, so today we're going to talk about the scapula, clavicle, and humerus, and we'll start with the scapula seen here. So scapula has a superior border, medial border, and lateral border seen here. The superior and medial borders will come together to create the superior angle. The medial and lateral borders will come together to create the inferior angle, and the lateral and superior borders will come together to create the lateral angle seen here. On the anterior surface, we have the subscapular fossa, which is where the subscapularis muscle will originate. We have the supraspinous fossa on the posterior surface, superior to the spine, which is where the supraspinatus muscle will originate. Inferior to the spine, we have the infraspinous fossa, which is where the infraspinatus muscle will originate. We have the spine seen here, which moves from medially and laterally. It's going to kind of project anteriorly to become the acromion process seen here. On the anterior surface, we also have the coracoid process seen here. And on the lateral border, we have the glenoid cavity seen here, which will articulate with the head of the humerus. Now we have our clavicle seen here. We can see that's an S-shaped bone. It has a medial or sternal end and a lateral or acromial end, which will articulate with the sternum and acromial process of the scapula respectively. We can see that the medial 2/3 of the bone curves anteriorly and the lateral 1/3 of the bone curves posteriorly. We can also see on the inferior surface the subclavian groove seen here. We have the conoid tuberosity seen here, and the trapezoid line seen here, and they will attach the conoid ligament and trapezoid ligament respectively to the coracoid process to create the coracoclavicular ligament. And lastly, we have our humerus seen here. We have the rounded head of the humerus, which will articulate with the glenoid cavity of the scapula. We have the anatomical neck, or the head of the mushroom cap, seen here. On the anterior side, we have the greater tubercle and lesser tubercle. Between them, we have this groove, which we call the intertubercular sulcus, seen here. At the distal end of the two tubercles, we have the surgical neck of the humerus seen here. And lastly, kind of interlaterally, we have the deltoid tuberosity seen here, and that will attach the deltoid muscle. All right, bye.